She didn't collapse. She didn't scream. She just slowly stopped making sense. And nobody knew why. This is a true story. And honestly, that's what makes it scary. Not because something sudden happened, but because almost nothing did. No clear warning, no obvious mistake. Just confusion that kept growing, while everyone thought they still had time. One morning at around 7 a.m., a 22-year-old woman was brought to the hospital by her mom. She'd been sick for a few days already. Stomach pain, throwing up, feeling weak. But that morning, something felt different. She wasn't thinking clearly. Her mom said she seemed off. Slow answers, a bit distant, like she was there, but not fully. At the hospital, doctors noticed her heart was beating fast and her blood sugar was low. They fixed the blood sugar right away with glucose through an IV. That part worked. But her mind didn't clear up. And that's where things stopped making sense. Even after her blood sugar was normal, she was still confused. That threw everyone off, because low blood sugar usually explains confusion. And once it's fixed, people usually feel better. She didn't. She also looked yellow. Not bright yellow, but enough to notice. She had pain on the right side of her upper stomach. When doctors checked her awareness, she was almost normal. Almost. Close enough to feel reassuring. Close enough to be misleading. Later that morning, the medical team talked about her case again. And this is where things got tricky. Every explanation sounded reasonable, but none of them really fit. Stomach bug? Didn't explain the yellow skin. Infection? Didn't fully explain the confusion. Blood sugar? Already fixed. Each guess made sense. Each one was wrong. Then someone asked a better question. Her mom mentioned that 3 days earlier, she'd taken flu tablets for a headache. Just normal painkillers. She didn't know how many, just that it was over a short period of time. And here's the problem. Nothing bad happened that day. Nothing bad happened the next day either. So no one thought much of it. That delay is what nearly killed her. Doctors realized she was dealing with a delayed overdose, the kind that doesn't hurt right away. Blood tests showed her liver was in serious trouble, and there was still medication in her system that shouldn't have been there anymore. Normally, there's a chart doctors use to decide what to do. But in her case, it was useless. Too much time had passed. Still, they started treatment immediately. She was moved to a higher care unit and watched closely. But instead of stabilizing, she got worse. Over the next several hours, her confusion deepened. She became less responsive. Eventually, she couldn't protect her own breathing. They had to put a tube in and help her breathe. A brain scan was done next, partly to rule out other causes, like bleeding or a stroke. That would have been an easier answer. But that wasn't it. Her brain was swelling. At that point, there was no doubt anymore. Her liver had failed, toxins were building up, and her brain was reacting. She was transferred to the ICU. Everything became intense and constant. Medications running non-stop. Treatments to support her blood, her brain, her liver, all of it. A transplant team was called. This is usually where people expect the story to end one way. But it didn't. They decided not to transplant. Instead, they kept supporting her body and waited, carefully, to see if it could recover on its own. And this is the part that surprises a lot of people. After about 3 days in intensive care, things slowly started to turn around. Her blood tests improved. The swelling in her brain went down. Her confusion lifted. One by one, the strongest treatments were stopped. Then she woke up. She was taken off the breathing machine later that day. She knew where she was. She remembered everything. No brain damage, no lasting confusion. Against all odds, her organs recovered. She stayed in the hospital for observation and psychological support. And 2 weeks after walking in confused and yellow-skinned, she walked out. No transplant, no permanent damage. Just a close call that depended on recognizing danger after it was already late. This story doesn't end with advice. It ends with something quieter. Some of the most serious damage doesn't hurt at first. It waits. And confusion is often the only sign that time is already running out. And this was a true story about that. Please subscribe, like, and comment.